Hi, we're going to produce a short video so you can see what happens when your dog comes in for surgery for a dental cleaning. A lot of people don't really understand what that involves, so we'll go over a few of the key points. You'll notice that this little fella is on a gas anesthetic and we have a respiratory monitor. That's really important during dentals, that you have them appropriately anesthetized so you can do the work you need to do. Also, we have a cuff that's inflated to keep water and tartar from going down into the lungs. That's super important. Some people think that when their pet goes to a groomer, it's getting the same sort of dental cleaning, but actually one of two other things are probably being done. Some groomers will brush the teeth, and I want to give you some idea how effective toothbrushing is at this point. And you can see that we've caused a little bleeding from the gums, but we haven't removed any tartar. Plaque turns to tartar in 36 hours, and once it becomes tartar, it cannot be brushed off. So while this may make the breath a little fresher, it's not doing anything to improve your pet's health. The other thing that some places will do is use dental instruments to remove tartar. In an awake dog, this can actually be quite uncomfortable because these dental instruments have to be very sharp to remove tartar, and they'll often cause, you can see the kind of force it takes to remove that, and that can be quite uncomfortable for the dog and cause a lot of bleeding. The other problem with that is it doesn't address the main problem with these pets, and that is the periodontal disease. Now, if you can see this instrument, it's measuring the pocket around that tooth, and it's actually going in as far as where my finger is pointing. That is periodontal disease. That ligament is lost, and this pocket is full of tartar and bacteria. And this is the area that's going to make your pet ill. This is where the bacteria comes from that leads to heart disease and kidney disease. If we just take off the tartar on the tooth, we're not doing anything to make your pet healthier. So we've got to address this area, and that's why we need a good anesthetic to do that. And if I probe up in different areas, you can see how bad this pet's periodontal disease is. And this is actually just a typical case that we see, and if you see, I can move this tooth. That one is going to have to be extracted, and that's not something you can do in a pet that's awake or that you'd even want to attempt, but that is a source of pain because of the movement of that tooth. So what we're going to do is use an ultrasonic scaler. This vibrates at super high frequency, and it removes tartar from the teeth. There are also a couple of cautions you have to observe with this. It gets quite hot, so you want to keep it moving, and you don't want to leave it on any particular route for more than 10 seconds. It's also like a tiny little jackhammer, so if someone who is inexperienced is using it and they're using it in this manner, they're making hundreds of tiny little pock marks on the tooth, but you're just going to trap tartar later. So you always want to keep it even with the tooth, keep it moving, and have a good water supply. Now I'm going to take the tip up under the gum line into the pocket. This is what root planing or subgingival planing is. And I'm actually cleaning out the tartar and the bacteria around that root. And that's going to help that tooth remain healthy. So I'm going to continue down along the outsides of these teeth and then on the insides of the bottom teeth, and we'll do the other side as well. Then once we get to where we're polishing, we'll come back and show you how we polish the teeth and how they look when they're completely done.